Compelled to achieve perfection? Well, it's no secret our culture is obsessed with beauty. But what you may not know is an estimated 8 million Americans are sacrificing their health just to achieve it. Dr. Julia Ney is a clinical psychologist and an expert in the field of eating disorders. She is now helping others and is joined today by Kristy, who's the mother of 2. Kristy is a former bikini model with a 23-year history of bulimia. She's now in recovery. And good morning, ladies. Thank you so much for joining us.
Good morning, Nikki. Thank you for having us.
Well, we're happy to have you to speak about something so important. And the first question I really want to ask you, Dr. Ney, is where are the seeds sown? People aren't typically born with a bad body image, are they?
It's a very complex question, but a good one. Actually, we're learning more and more that genetics play a tremendous role in who develops, especially anorexia. So there is a genetic component. Individuals who have anorexia are at 3 to 12 times greater risk to have offspring that also have eating disorders. The seeds are also sown in environment, culture, how we cultivate or don't cultivate healthy self-esteem in our children, focus on diet, focus on exercise that is excessive and unhealthy. There's a biochemical component as well. So it's a very multifaceted equation, and you have 2, 3, 4 of these factors, and unfortunately they culminate in the presentation of an eating disorder.
Wow, it is very complex. How is there a way for us to keep from getting off track if you are coming into a situation where it is a genetic issue? How do you keep from getting off track?
That's a wonderful question also. One of the reasons why I wanted to do this wonderful show is to increase not only awareness but understanding of what eating disorders are all about. And if there is a history of an eating disorder in your family or in yourself, it is so important to give your children healthy messages, not only about themselves directly, but to work on developing a healthy body image within yourself, to have healthy self-esteem, to have positive messages and unconditional self-acceptance. And that's going to get modeled to your children. So it's not just what we say to our children, it's what we say to ourselves that matters as well.
Fabulous. Well, as a parent, then, what do you need to look for? What are the signs?
As a parent, you want to look for certainly the most obvious, which would be drastic weight loss or sometimes weight gain. You also want to look for a difference in emotional presentation. Maybe there was a child that was happy and outgoing, and now they seem more isolative, more reserved, more depressed. Withdrawing from social activities, not going to pizza with friends on Friday night, staying in their room, you know, not eating. Excuses about not eating, I just already ate, or it's going to upset my stomach. Right. Those kinds of things.
Okay. Well, thank you so much. That is so important, and it's so helpful to the parents out there.
Thank you.
Speaking of parents, Kristy, question that has really been weighing on my mind is, what happened when you were pregnant? How did you deal with this? Did you purge during that time?
I was very honest with my doctor about my history, and I knew what I had to do. It wasn't always, I knew I had to feed my body and make sure there were enough nutrients going in every day. There were times that I slipped, and but all in all, I mean, with both pregnancies, I did gain 50 pounds. So I had to take precautions. If I slipped, I immediately ate a meal after and kept it down. I would always eat right before I went to bed, so I wouldn't be tempted to purge. I would eat a big meal before bed. Those were some of the things. I made a big protein shake every morning and drank that.
Okay.
There were times that I slipped, but it was one thing to abuse myself, but with another life inside of me, I wasn't going to abuse another life.
Well, that's fabulous, and thank goodness for the blessings that everything turned out well and that you're in recovery now. Kristy and Dr. Ney, thank you so much for being with us today, and we really appreciate you bringing awareness to the subject.
Thank you.